Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering different aspects of the endocrine system. If you're new here, welcome. If you haven't done so already, guys, please don't forget to like and subscribe below. Also, I'm now on TikTok, so you guys can check me out on TikTok. Same name, Nexus Nursing, as well as Instagram. So without any further ado, guys, let's get started. First question. What should be included in a nursing care plan for a client diagnosed with diabetes insipidus? 1, blood pressure every hour. 2, strict INO. 3, urine for ketone bodies. Or 4, glucose monitoring 4 times a day. And the correct answer, guys, is 2, strict INO. So what's happening in diabetes insipidus, the patient has excessive amounts of urine that they're producing. Why? They don't have enough antidiuretic hormones. Remember, ADH, that's what keeps the patient holding on to their fluids. But since this patient doesn't have enough ADH, they're just releasing all of that fluid. Here's what's so crazy, guys. So the patient's getting rid of all their fluids, which is putting them at risk for dehydration, right? We're worried about their fluid electrolyte status. That's why we're doing strict INO. Here's what's so crazy. Even though they're releasing all of this fluid, right? The urine specific gravity is very small. So urine output is high, but the specific gravity is low. Why? All of the minerals, all of the nutrients, everything is staying in the blood. All right. So the serum osmolality is high because the sodium, everything's staying in the blood. So the serum osmolality is high. Urine output is high. But urine specific gravity is low. You need to know that. All right, moving on. What must a nurse do when preparing a client for a CT scan? A, administer a laxative. 2, encourage fluids. 3, explain the procedure. Or 4, administer a radioisotope. I'm not a fan of this question. However, the choices that we're given, the answer has to be 3, explain the procedure. This is a diagnostic test, and out of the choices we've been given, this is the only one. So this is what the nurse is going to do. And when I say explain the procedure, it's going to be in very simple terms, tell the patient what's going to happen. It is not the nurse's responsibility, nor should she try to explain, the benefits of the procedure, the complications of the procedure, what can happen to the patient if they refuse the procedure, all of that. That's the physician that's actually doing that CT scan, okay? This is a diagnostic test. No, it's not a surgery, but it's still a diagnostic test that the patient does have to consent to having, okay? So that's what the nurse is going to do. They're going to explain this procedure in just, very simple terms. Now, the other choices, no. Giving a laxative prep, that's not necessary for a CT scan. Encouraging fluids, you want to encourage fluids, but that's after the CT scan. Why? You want to flush all of that iodine through that patient's body, okay? So you're going to flush their system afterwards. You want to encourage fluids. And choice 4, administer a radioisotope. That also, guys, is not necessary for a CT scan. All right, guys, I said iodine. Iodine is actually in the, what's the word that I'm looking for, guys? Contrast media that's used. So I really should have said contrast media. Okay, so we give them fluids. We encourage fluids afterwards to flush out that contrast media. All right, next question. Antibiotics are ordered for a client who's had a transsphenoidal hypophysectomy. He asks why he's receiving an antibiotic when he does not have an infection. The primary reason for administering antibiotics to this client is based on which information? 1, antibiotics will help prevent respiratory complications following surgery. 2, meningitis is a complication following transsphenoidal hypophysectomy. 3, fluid retention can cause dangerously high cerebrospinal fluid pressure. Or 4, hormone replacement is essential after hypophysectomy. And the correct answer is 2, guys. Meningitis is a complication following transsphenoidal hypophysectomy. That's something that can happen. So, guys, a transsphenoidal hypophysectomy, basically, this is surgery in your brain, but they're not cutting into your skull. They're going through the roof of your mouth, sometimes through the nose, but most often it's through the roof of the mouth. So think about it. If they're going through the roof of your mouth to get to your brain, all it takes is one tiny little pathogen that's either in your mouth or your nose going to your brain, causing the patient to get what? Meningitis, which is infection of the brain. Okay, so that's why they get the antibiotics. The antibiotics are given, prophylactically to help prevent infection formation. Okay. 12 hours after transphenoidal. Guys, you know I can't talk. You know I can't speak. Okay. 12 hours after transphenoidal hypophysectomy, the client keeps clearing his throat and complains of a drip in the mouth. To accurately assess this, the nurse should test fluid for 1, sugar, 2, protein, 3, bacteria, or 4, blood. And the correct answer is sugar. Why are we testing it for sugar? Well, they gave us a couple clues. They told us that the patient keeps clearing their throat, so we're thinking there's some kind of drip going on. And then it says they complain of a drip in their mouth. We're suspecting possibly cerebral spinal fluid. So we're going to test that fluid for glucose. Why? Because cerebral spinal fluid has glucose. Guess what? Saliva and mucus does not. You know how you have mucus in your nose, saliva in your mouth? Well, those two don't have glucose. Those two don't have glucose. So if that fluid is positive for glucose, we know that, that patient's brain is leaking. That's cerebral spinal fluid, and we're going to call the doctor right away. The client is ready for discharge following an adrenalectomy. Which statement that the client makes indicates the best understanding of the client's condition? 1, I will continue on the low sodium, low potassium diet. 2, my husband has arranged for a marriage counselor because of our fights. 3, I will stay out of the sun so I will not turn splotchy brown. 4, I will take all those pills every day. And the correct answer, guys, is 4, I will take all those pills every day. A patient that has a bilateral adrenalectomy, both of that patient's adrenal glands are gone. That means they have nothing inside of their body that is producing that salt, mineral corticosteroids, that sex, your androgen hormones, that sugar, your glucocorticoids. They are gone. And that patient needs those steroids, otherwise they're not going to survive. They have to take those pills for the rest of their lives. So that's the correct answer. Choice 1 is wrong because the patient actually needs to be on a high sodium, low potassium diet. Remember, the adrenal gland that produced the sodium, that's your mineral corticosteroids, it's gone. So they need to be on a high sodium, low potassium diet. So that's wrong. Choice 2, the reason that's wrong, we expect the fights to go down because the patient's mood swings go down because they're taking their meds and their hormones are going to be more balanced. Choice 4, I'll stay out the sun. Steroids don't cause photosensitivity. Okay, so that's wrong. And that's why number 4 is the correct answer. What is a nursing priority when administering care to a client with severe hyperthyroidism? 1, assess for recent emotional trauma. 2, provide a calm, non-stimulating environment. 3, provide diversionary activities. Or 4, encourage range of motion exercises. And the correct answer is 2, provide a calm, non-stimulating environment. This patient has hyperthyroidism, where everything is hyper. Blood pressure through the roof, heart rate through the roof, peristalsis through the roof. That's why they have diarrhea all the time. Cognition, thinking through the roof. That's why their brain's going. That patient's at risk for seizures, right? So we want to slow everything down. You're going to treat them kind of like a seizure patient, right? Give them a calm, quiet environment, okay? This type of patient, they're going to be hot all the time because the metabolism is going. It's through the roof. So you're going to put them in a cool environment. Which problem is most likely to develop if hyperthyroidism remains untreated? 1, pulmonary embolism. 2, respiratory acidosis. 3, cerebrovascular accident. 4, heart failure. And the correct answer, guys, is 4, heart failure. I just told you everything goes through the roof. That tachycardia can get so bad that the heart rate can go up to 150 beats per minute. Now, mind you, you guys know that the normal heart rate is 60 to 100. So that heart might just give out, okay? Because it's what? Through the roof. So we're going to be watching out for that. Which nursing care measure is essential because a client has exophthalmos? 1, administer artificial tears. 2, encourage a client to wear her glasses. 3, promote bed rest. 4, monitor her pulse rate every 4 hours. Okay, guys, and the correct answer is 1, administer artificial tears. So this patient that has hyperthyroidism, they've got exophthalmos, that's what? The bulging eyes, right? And sometimes those eyes are bulging so forward, the eyelids can't even close. And so we're going to give them the artificial tears because we want to prevent abrasion, right? Because every time you close your eyes and you blink, you're remoistening your eyeballs. Well, if this person's eyeballs aren't even closing because the lid can't go over the eyeball, the patient can get what's known as corneal abrasion. So we're going to give them artificial tears and we're going to encourage them to use them. A client who just had a thyroidectomy returns to the unit in stable condition. What equipment is essential for the nurse to have readily available? 1, a trach set. 2, thoracotomy tray. 3, dressing set. Or 4, ice collar. If a patient gets a thyroidectomy, if a patient gets a parathyroidectomy, you better bet your bottom dollar. You better have a trach set at the bedside, okay? Why? Just think about it. This patient had surgery right here in their neck, okay? So, the operative swelling alone can occlude the patient's airway, okay? Without even getting into them possibly nicking the parathyroids. Before you know it, patient went into hypocalcemia, and you guys know hypocalcemia causes nerve and muscle irritation. Before you know, their throat starts closing up anyway. So we're going to make sure that we have that trach set right there at the bedside in case their airway gets occluded. What is the best way to assess for hemorrhage in a client who's had a thyroidectomy? 1, check the pulse and blood pressure hourly. 2, roll the client from side to side and check for evidence of bleeding. 3, ask the client if he or she feels blood trickling down the back of their throat. 4, place a hand under the client's neck and shoulders to feel bed linens. Okay, guys, and the correct answer is 4. You're going to place your hand, of course, it's going to be a gloved hand, guys. Whenever you may possibly come in contact with something wet, whether it's blood, semen, saliva, feces, vomitus. If it's wet, you're going to put on gloves. So with a gloved hand, you're going to place it under their neck and shoulders to feel the bed linens for bleeding, okay? Now, let's look at the wrong answers. We have 1, checking the pulse and blood pressure hourly. That's wonderful. You want to do that. But the first thing you're going to do is actually look, and you're going to feel and look, okay? Choice 2, roll them from side to side. No, you're not. They just had surgery in their neck. So because of that operative side, you're not going to be moving that patient side to side. No way. 3, ask the client if he or she feels blood trickling down the back of their throat. For this type of surgery, it's not going to be on the inside. And because this patient's going to be sitting up, they're going to be in a semi-Fowler's position. We expect that blood to trickle back towards the back of their neck, okay? Not on the inside. And that's why number 4 is a correct answer. Which finding would be the greatest cause for concern to the nurse during the early post-op period following a thyroidectomy? 1, temperature of 100 degrees. 2, a sore throat. 3, carpal spasms when the blood pressure is taken. 4, complaints of pain in the area of the surgical incision. And the correct answer, guys, is 3, carpal spasm when the blood pressure is taken. We are going to be very concerned about that. Why? Because if we're taking the blood pressure and then we see carpal spasms, what does that tell us? Tetany. More specifically, what kind of tetany is that? Trousseau's. When do we see tetany? When do we see trousseau's? When the patient's hypocalcemic. So here we are. Patient had surgery on their thyroid gland. They got the thyroid gland removed, but remember those 4 nodules that sit right on top of the thyroid gland, those are your parathyroids that are responsible for calcium. So that could have thrown that patient into hypocalcemia. So we're going to be concerned about that. We're going to call the doctor. We're going to be drawing blood. That's going to be our concern. Now, don't forget, because I see a lot of test questions, they like to ask the one about the blood pressure, which I just told you is Trousseau's, and the other one is Chostek. Chostek starts with a C, and so does your cheek. This is when you touch your side of cheek, and they go like that. That's a style that they have in their face muscles, okay? So the cheek starts with a C, that's Chostek sign, and Trousseau's, that's the blood pressure, that's Trousseau's. So those are 2 different forms of tetany that we see in hypocalcemia. All right, moving on. An adult is admitted to the hospital with a diagnosis of hypothyroidism. Which findings would the nurse most likely elicit during the nursing assessment? 1, elevated blood pressure and temperature. 2, tachycardia and weight gain. 3, hypothermia and constipation. Or 4, moist skin and coarse hair. And the correct answer, guys, is hypothermia and constipation. This is a patient with hypothyroidism. Everything is slow. Blood pressure down. Heart rate down. Thinking down. Peristalsis down. That's why they're constipated all the time, right? This patient's always what? Cold, all right? They have cold intolerance. So that's the correct answer. Now let's look at our other choices, which is wrong. 1, our elevated blood pressure. We see that more in hyperthyroidism. And elevated temperature, we see that more in hyperthyroidism. Choice 2, tachycardia. We see that more in hyperthyroidism. Weight gain. Weight gain, we see that more in hypothyroidism or Cushing's. However, the reason number 2 is still wrong is because of the first part, the tachycardia. Remember, guys, if the whole thing is not right, the whole thing is wrong. Get rid of it. And then lastly, for moist skin and coarse hair, that's wrong. We tend to see that more in hyperthyroidism. Which diet does the nurse expect will be ordered for the client with hypothyroidism? 1, high protein, high calorie. 2, restricted fluids, low protein. 3, high roughage, low calorie. Or 4, high carbohydrate, low roughage. And guys, the correct answer is 3, high roughage, low calorie. What is roughage? Roughage is basically fiber, things that do not get digested, right? It goes in and it comes out. It does not get digested, okay? So why are we going to give that to this type of patients? Because they have hypothyroidism. Remember, everything's working slowly, even their gut, even the peristalsis. So they tend to be what? Constipated. So we want that roughage to pull all of that crap that's sticking to the inner lining of their GI tract. So when they have a bowel movement, they can get rid of it. And we want low calories. Why? Because the patient's already obese. They have hypothyroidism. They're not burning any calories. So guess what? They don't need any more. That's why it's going to be a low calorie, high roughage diet because of the constipation and the obesity. An adult client with myxedema is started on thyroid replacement therapy and is discharged. The client returns to the doctor's office 1 week later. Which statement that the client makes is most indicative of an adverse reaction to the medication? 1, my chest hurt when I was sweeping the floor this morning. 2, I had severe cramps last night. 3, I'm losing weight. 4, my pulse rate has been more rapid lately. And the correct answer is 1, guys. That lets us know, okay, this is an adverse effect of the drug. So let's go back to the question so we can figure out what's happening to the patient. Patient had myxedema, which is a form of hypothyroidism, and they're a bad form of hypothyroidism, guys, like the excessive end, right? And they've been placed on thyroid replacement therapy. So they're probably on something like Synthroid, which is a type of thyroxine, all right? Okay. So now they come in and they have these complaints. Which one is the adverse? Well, let's think about what thyroxine, what Synthroid does. It speeds things up because remember, this patient was hypo, everything was down. Now they're taking a medication to speed things back up. Well, what happens if that medication works a little bit too well? We would see hypertension. We would see tachycardia to the point the patient gets what? Chest pain with any type of exertion. And that's what we're seeing right here in number 1. Choice 2, I had severe cramps last night. They try to throw you off with that word severe, but cramps, that's not even related to the thyroxine or Synthroid. So that's wrong. Then we have choice 3, I'm losing weight. Good. We want you to lose weight. That's wonderful. And choice 4, my pulse rate has been more rapid lately. That's good. We want that as well because remember, the pulse was too low. So we want the pulse to be increased, but not to the point that it throws a patient into angina, not to the point that they're tachycardic. We want that pulse to be between 60 to 100, okay? All right, guys, last question. The nurse's next door neighbor calls. He says he cannot awaken his 21-year-old wife. The nurse notes that the client is unconscious and having deep respirations. Her breath has a fruity smell to it. The husband says that his wife has been eating and drinking a lot recently and that she vomited last night while lying down. What's the most appropriate action for the nurse to take? 1, start CPR. 2, get her to the hospital immediately. 3, try to rouse her by giving her coffee. 4, give her sweetened orange juice. And guys, the correct answer is get her to the hospital. What are we suspecting? We are suspecting that this patient's going through what? Diabetic ketoacidosis. Okay, there's so many clues. Let's go back to the question. It tells us that she's unconscious with deep respirations. Why do you think those respirations are deep? Blowing off all that what? Acid, the CO2. Remember, CO2 is acidic, right? Patient is in acidic state and their body's trying to survive. So they're blowing off that CO2, which is acidic, trying to throw them back into equilibrium. That's our first hint. 2, fruity breath. Diabetic ketoacidosis. 3, been eating and drinking a lot. Polyuria, polydipsia, right? Remember? Polyphagia. And what else? Okay, vomited. All of those are signs and symptoms to let you know this patient is most likely going through diabetic ketoacidosis. 1, start CPR. Why? It says she's breathing. The patient's unconscious, but they're breathing. CPR for what? No. Choice 3, try to rouse her by giving her coffee. You're going to put a liquid into an unconscious patient's mouth. Really? So what you want to do is have them aspirate and kill them. No, we're not going to do that. And we're definitely not going to give orange juice. Number 1, the patient's unconscious. We're not putting anything in their mouth. And number 2, they're already going through diabetic ketoacidosis. That blood sugar is too high. Why would you want to give them orange juice? No, we're going to get them to the hospital right away. Guys, if you appreciated this video, please let me know in the comment section. Any videos you want to see me cover, or if you want to see me go more in depth on endocrine, let me know. Please don't forget to check me out on TikTok. This is awesome, guys. I'm up to 60,000 followers on TikTok. Lots of people who aren't even in the nursing program, they're just very interested in this material. I've gotten a lot of feedback on that. Check me out there. Also on Instagram, same name, Nexus Nursing. Guys, thank you so much for joining, and I'll see you on the next video.